All right, so this last segment's usually about 10 minutes long. We'll wrap up in a little bit, but we're back with Ava Chase, and we're talking about the two critical things about empowering nurse practitioners to be the best versions of themselves. Everyone at NPHub, we believe in that so wholeheartedly. So when Ava said that was one of her missions, I literally jumped up. Like, we were on video chat like this, and I literally jumped up. And we're talking about procedural needs for nurse practitioners. Now, that's not something I'm well-versed in. I am not smart enough to be a nurse practitioner, so I'm going to give the floor to Ava to really dive into this one.
I'm well-versed in that, yes. So procedural, really what our company teaches is what things are within the scope of practice of nurse practitioners. And most state practice acts are written in such a way that state that you're basically able to do what you are considered to be trained to do. So they leave it open. They don't give a list of what you can do, because then anything that's not on the list could be construed as something you can't do. So most boards of nursing leave it pretty open and say what you are trained to do, you are able to do within certain boundaries, obviously. So we do, in our courses, we teach a lot of suturing and stapling and wound closure techniques. We teach joint injections. We teach casting and splinting, toenail removal, lots of different types of injections like trigger finger injections, de Quervain's injections. We teach incision and drainage. One of the things I do every Wednesday all day long is I do circumcisions. I don't teach that. We don't teach circumcision in our program because I think I'm one of the few NPs that actually gets to do that task. But anything else you can think of that we do in primary care, I'm either a really good NP or I'm a moil. I don't know, but you can do. And so we teach all of those things. And the thing is, you need to be able, as a nurse practitioner, if it's interesting to you, to be able to work to the full scope of your practice. That's how you look smart, is to be able to work to the full scope of your practice. And so when I tell the students, when they come to my classes, I say, you have the clinical judgment, you have the clinical knowledge to be able to do these procedures. All I'm teaching you are the steps, and that's not hard. Somebody else has already done the hard work. They've taught you the clinical judgment of knowing when to do, what to do, etc. I'm just giving you the how to do, which is all it is muscle memory. So you just need to know the how to, because you already have the rest of the knowledge. But you don't want to be the person that I was the first week in practice when I started my brand new job. There I was with my crisp white lab coat and a laceration, walked in the door, and the doctor looked at me and said, go sew that up. And I had never held a needle driver in my life. My NP program did not prepare me to suture patients. So I learned on the job, and thank goodness I had physicians who were willing to teach me anything I wanted to learn. And I took advantage of that. Take advantage of your mentors. And just don't sell yourself short. As a nurse practitioner, you are an advanced practice nurse. You are not a mid-level provider. You are not a non-physician provider. You are an advanced practice nurse. Doesn't that sound better?
It does. And
I went to our CEO of our organization because they were calling us mid-level providers in our organization. And I said to him, Chris, would you rather see an advanced, a mid, or a non? And he said, I'd rather see an advanced. What does that tell the patient? If you're a non-physician provider, which is what Medicare calls us, or you're a mid-level provider, which a lot of hospitals call us. And a lot of people think that physicians do that to us on purpose. A lot of times they don't do it to us on purpose. It's just a term that somehow has gotten thrown out there and stuck. So we need to be the culture of change. And when I pointed that out to Dr. Gordon, who is our medical director, he said, gosh, I never thought about it that way. You're absolutely right. I would much rather see an advanced. And so our term within our organization got changed to advanced practice provider. So we need to be an institution for change. I am what I am, but I'd rather be called advanced than mid or non, because I really think I'm a smart person, and I think that I am an advanced nurse. I don't want want to be a junior doctor. I'm not interested in that, or I would have gone to medical school. I want to be an advanced nurse because I think I'm a darn good nurse. So, be proud of what we are and empower yourself to practice to the full scope of your practice act.
That's amazing. 100% amazing. I cannot tell you how many different, especially